Okay, good day, everyone. Welcome to the Psychedelic Support Monthly Speaker Series. I'm your host, Dr. Allison Fiducia. Today, we will be hearing about an international survey that was conducted by Dr. Philippe Lucas and his colleagues, which gathered responses from over 6,000 participants around the world about their psychedelic use. And a couple of notes, we will be recording this and sharing it after in the email and on our speaker page, which I'll drop the link in a moment. You can chat here in the chat box with each other throughout the presentation, say where you're calling in from, introduce yourself. And if you have a question, we're gonna try to make time at the end to get to as many as possible. There is a box in the lower dashboard that says QA. So that's the best place to drop your questions. So with that, I'm going to introduce Dr. Philippe Lucas, who is a distinguished cannabis and psychedelic researcher, a passionate advocate for patient access, and has worked with governments around the world to develop evidence-based drug policies. And I had the pleasure of first meeting Dr. Lucas at a conference nearly 10 years ago. And I believe we were the only presenters there talking about cannabis and psychedelics. So suffice to say, we made fast friends, and I've really enjoyed hearing him speak on a number of different topics. And currently, Dr. Lucas is the president of SabiMind, which is a clinic group in Canada that's providing access to psychedelic-assisted therapy in the treatment of mental health, pain, and substance use disorder. Dr. Lucas was the founding board member of MAPS Canada and the co-founder of the Victoria Association of Psychedelic Studies. And he is the principal investigator of the Canadian Psychedelic Survey and co-PI of the Global Psychedelic Survey 2023, which we're going to be hearing about today, the results and the findings, which I'm just kind of thinking about how different the results would have been on this even just 10 years ago. And I hope that you're able to repeat this survey in another 10 years for some compare and contrast about the trends. But nonetheless, he has also previously coordinated observational study on ayahuasca as a treatment for trauma and addiction in cooperation with the BC Indigenous Band. And more recently, he has worked as the VP of Global Patient Research and Access at Tilray, where he oversaw a comprehensive international clinic and observational clinical research program. He has done a lot more work, so I'm going to also drop in some links to his LinkedIn and website so you can learn more about his research and work going on at Sabi. So I will go ahead and turn it over to you. Thanks for being here.
Thank you so much, Ali. It's really great to be here. I really want to thank Psychedelic Support for hosting this presentation and you for this invitation, this opportunity to share some of this really interesting, right, fresh off the presses kind of data. I also want to acknowledge that I live here in Victoria, BC, and I respect the Lekwungen peoples on whose traditional territory I live and work, and the Songhees, Esquimalt, and Wasanich people whose historical relationships to the land continue to this day. I'm going to go through the presentation, and then hopefully we'll have 10 or 15 minutes at the end for questions. And I look forward to hearing your thoughts and your questions. And to skip ahead a little bit, Ali, we do plan on redoing this survey every couple of years so that we can actually track the impact of policy changes around the globe, and I'll talk about that at the end of the presentation as well. So without any further ado, let me just call up my presentation. And Ali, I'm just going to ask you to make sure that everyone can see everything all right. All right, here we go then. So I want to start by sharing my theoretical background, which is that my focus of most of my research is observational, community-based research informed by the principles of harm reduction, cognitive liberty, and personal rights and freedom. My guiding principles for this study and much of my research is that psychedelic and cannabis consumers and practitioners are the experts and should be involved in policy decisions impacting them. And the quote below, "Nothing about us without us," is taken from the HIV/AIDS community from Vancouver that was having a lot of research being conducted in the downtown east side in the late 90s when we were the epicenter of the opioid overdose crisis. and the substance users themselves wanted to be involved in the design of the research, as well as any assessments on potential treatments that would be considered as well. So nothing about us without us also applies to the psychedelic community, as governments around the world form regulations and policies around safe access to psychedelics. My goal ultimately of this research is to translate end user experiences in the form of real world evidence into data that informs policies and can improve safe access. Just a quick note about my employer, Savvy Mind. As Ali mentioned, we're a clinic group based in Alberta, and we just opened up a Victoria clinic to go along with our Calgary clinic as well. We have a real interest in evidence-based care, and we really value both clinical evidence, and in fact, we're just finishing up a phase 2 trial on psilocybin and alcohol use disorder sponsored by Clairvoyant, but also on observational real-world evidence. And as part of that, we use a measurement-based care approach to our treatments to track patient outcomes that we then share with policymakers and private payers. And the Canadian Psychedelic Survey and the Global Psychedelic Survey are part of exercises that we do to kind of raise the level of knowledge around psychedelic use overall. Now on to the Global Psychedelic Survey. So the goal of GPS was to gather real-world evidence on the recreational and therapeutic use of psychedelics around the world. This was a very long survey, it's 600 plus questions, and we only did 2 weeks of data gathering for the survey from May 19th to June 2nd of 2023. So this is very recent data, it's less than a year old. We gathered data from English-speaking psychedelic consumers that were 21 or over, and we gathered information on patterns of use for 11 common psychedelics, including self-reported impacts on physical and mental health. The study was co-sponsored by MAPS, Mind Medicine Australia, Savvy Mind, and the Tiny Foundation, and it involves some broad academic collaborations. First of all, let me recognize my co-primary investigator, Stephanie Lake from UCLA, as well as some of our other collaborators like Eric Barron at Cleveland Clinic, Peter Hendricks and his team at the University of Alabama, David Yaden, Mariona Swozy, and Matthew Walkerton at Johns Hopkins, Hofstra University, and Monash University, respectively. Kevin Boyke and his amazing team, Daniel Kruger, Nick Glinos, and Nick Coleman from the University of Michigan, Sarah Daniels and Zach Walsh at UBC, Kyle Greenway and Alex Lehman at McGill University, Bailey Vanderswag at the University of Victoria, Jill Robinson and Shayla Frinton also at the University of Victoria, and Roden Petranker and Omer Syed at the University of Toronto. Following data cleaning and coding, we ended up working with a cohort that was about 6,379 participants, and here's what we found. Well, ultimately, we received responses from 85 countries. However, this was an English language only survey, which certainly limited participation outside of traditionally Anglophone regions. And so white participants were significantly overrepresented, as you can see on the chart on the left. And over 90% of respondents reported their country of residence as either being the United States, Australia, New Zealand, Europe, and the UK, or Canada. Overall, the average age of these respondents was about 43 years old. We had a good balance of male and female respondents, and I was really pleased to see that 2.3% of respondents were non-binary. The relationship status, about 58% were in a committed relationship, so that's married or equivalent. In terms of education, this was a very well-educated population. 85% or so had a university, college, or technical degree. And most of these respondents, about 80%, were working full or part-time. I think that this data helps break down a bit of the stereotype around who's using psychedelics around the world. I think there's still this perception that it's first and second year university students just drinking a pot of mushroom tea in a dorm for kind of shits and giggles. But I think that this data really shows that we have a very diverse population of psychedelic consumers around the world, and that many of them are well-educated and in stable relationships, work relationships, as well as personal relationships. In terms of psychedelic use, as I mentioned, we were asking about 11 common psychedelics. And so the 11 psychedelics that we asked detailed questions about are 2CB, ayahuasca, DMT, and 5-MeO-DMT. And before you ask me, yes, in future versions of this survey, we're going to be splitting out DMT and 5-MeO-DMT. I know that the combination of those two substances irks some members of the psychedelic community. We asked about iboga and ibogaine, ketamine, LSD, MDMA and MDA, mescaline, nitrous oxide, psilocybin, and salvia divinorum. And what we found is that the age of first use of psychedelics was about 25 years old, which means that sequentially, psychedelic use comes much later than the average start for tobacco use and alcohol use, and cannabis use as well. So in North America, for example, most cannabis use begins between the ages of 15 and 16 years old. So sequentially, psychedelics will come significantly later than that. About 80% of our respondents reported past year use, and about 64% used less than once per month. So what we saw is that there was common use and that most people used in the past year, but the use itself was very infrequent. And if you look at this bar right here, or this column, time used comparing the median and the mean, you can see that frequent users definitely skew the mean in terms of lifetime use. So the median use of psilocybin, for example, would be 10 uses in one's lifetime, but the mean use was 38 uses. And so you see much more, you see that frequent users definitely move the mean. Now we're going to be looking at micro use by primary regions. And the three regions that we focused on for this presentation are Australia, New Zealand, in blue, Canada and the US in orange, and the EU and the UK in gray. Those are the primary catchments of the respondents of this study, and that's where we focused on, although our publications also add another category to capture the rest of our respondents that weren't in these regions. So about 74% of all of our respondents report microdosing, and 75.7% of microdosers report past year microdosing. So most of them, if they were microdosing, were doing so in the last year. 2.5% of our survey respondents only microdose, so they haven't had experiences with regular or macro doses of psychedelics. And psilocybin, as you can see by both these charts in terms of past year micro and lifetime micro, is by far the most reported microdose, followed by LSD and ketamine. And if you look at the orange bar in past year micro and also in lifetime micro, you can see that Canada and the US see slightly more diverse patterns of micro use compared to Australia, New Zealand, or the EU. And what I mean by that is that people in Canada and the US are much more likely to have microdosed substances like DMT or 5-MeO-DMT or ketamine, or even salvia divinorum than their counterparts in Australia, New Zealand, or the EU. In terms of macro use, so regular psychedelic use of these substances, about 95% report lifetime macrodosing, and 77% report past year macro use. Once again, the most frequently reported macrodose across jurisdictions is psilocybin, but you see that LSD and MDMA are close behind. And in fact, we see greater patterns of LSD and MDMA use in Australia and New Zealand, as well as in the EU and the UK than we see in US and Canada. That may be reflective of trade routes, the way the illicit market distributes a lot of these substances, with a lot of the MDMA production in Europe going through those parts of Europe on the way to end users as well. So it may be reflective of general trade of illicit substances in those jurisdictions. In terms of access in the past year, purchasing from a friend and the black market or street dealers were the primary points of past year access. But when we asked these end users, how would you like to access your psychedelics? What would be the ideal forms of access? You see that the preferred modes of access are retail dispensary, produce or harvest myself, and clinic and healthcare professionals. And in fact, the least desirable form of access when we ask about preferred access is black market or street dealers. So that really lets us know that psychedelic consumers want to be able to access their psychedelics from a legal source where there's quality testing going on and some known and well marked dosages in order to be able to know exactly what kind of journey they're about to get into. And unfortunately, in most jurisdictions around the world, that's still not the case. Access is still through friends or the black market. In terms of the intent of use, there were a variety of reasons that were cited, but personal growth, general well-being, and recreation were the most common. It is notable, however, that over 16% also note that they use psychedelics to reduce their use of another substance. In other words, with psychedelic use, we often see that it's not an add-on to other substance use, but can actually be a substitute to potentially more problematic substances as well. And so we'll talk a little bit more about that in the ensuing slides. I'm very interested in patterns of use in terms of the actual days that people are using psychedelics in a macro dose. And so we asked respondents, do you co-use the other substances either 2 hours before you use a psychedelic, while you're using a psychedelic in a regular dose, or 2 hours after you finish your journey with a psychedelic in a regular dose? And over half of respondents said that they co-use at least one other psychedelic with another substance. In terms of the co-use with other substances, the psychedelics that were most likely to see co-use were nitrous oxide, over here at 54%, MDMA at 50%, LSD at 41%, and ketamine. Now, it should be no surprise because these substances, these particular psychedelics, although they do have therapeutic effect, are also the psychedelics that see the most recreational use. And that's where you'd be more likely to see the co-use with other substances like alcohol, cannabis, etc. To support that assertion, if you look over to ayahuasca, you see very little co-use at 14%. And those that use ayahuasca in a traditional setting will know that the practices around ayahuasca use often involve dietary restrictions and restrictions on the use of alcohol as well as other unregulated substances. We see the same thing with ibogaine as well, where the use of other substances is often discouraged. And also short-acting psychedelics like DMT and salvia, where the journeys are quite short and there's probably no occasion to actually use something while you're specifically using those psychedelic substances. In terms of which other substances were most co-used with psychedelics, either before in blue, during in orange, or after a psychedelic experience in gray, cannabis was the most commonly co-used substance, followed by alcohol. And as you can see by the orange bar here, most of the cannabis use, or the highest rate of cannabis use, takes place during the psychedelic journey, although we do see a lot of use following the psychedelic journey as well. We asked participants why they're co-using. In most cases, they're co-using to amplify the psychedelic effects. There is an exception to that, however, which is that depressants were actually an exception in that they were most used or used most often following a psychedelic journey, and they were used to bring down the psychedelic effects. So the way that this might look in a pattern of use analysis would be that people have a couple of beers or smoke a joint before they ingest their psychedelic. They use a psychedelic like MDMA and psilocybin, at which point they might use more cannabis or alcohol or tobacco to enhance the effects, or even a second psychedelic to enhance those effects. And then they would use a depressant like a benzodiazepine in order to get to sleep that night. The reason that this kind of information I find is so important is whereas most psychedelic substances don't have a high potential for harm, certainly if we find out that people are combining those substances with, say, cannabis or alcohol, we really want to be clear about discouraging putting themselves in a situation where they might need to drive a vehicle, for example, or in high-risk situations where they might need physical coordination. So harm reduction messaging can be directed not just at the psychedelic use itself, but also in the co-use of other substances. Now, as I mentioned earlier, in a lot of cases, when people start using psychedelics, it's not an add-on to their other substance use. And whether they mean to or not, they often see reductions in their use of other substances following their initial initiation with psychedelics. And when we ask that question, did your use of, for example, tobacco, prescription opioids, unregulated opioids, cocaine, cannabis, benzodiazepines, etc., did your use of these substances change as a result of your use of psychedelics? About 70% reported ceasing or decreasing the use of at least one other substance. 60% ceased or decreased their use of alcohol following their psychedelic use. Oh, and by the way, if you've never seen this kind of graph, let me just show you how to interpret this. This graph represents 100% of all the lifetime users of tobacco, those that report lifetime use. And in blue, you see the percentage that ceased their use of tobacco following psychedelic initiation. In orange, those that decreased their use of tobacco. In gray, those that saw no change. In yellow, those that increased their use. And blue, those that initiated use of tobacco following psychedelic experiences. So in looking at that, you can see that in terms of alcohol use, you see a significant reduction in orange, a decrease in use, following psychedelic initiation. And you also see a significant decrease or ceasing of use of antidepressants, as well as cocaine and crack. Now, there was some increase or initiation of use. About 20% reported initiating or increasing the use of at least one substance. 14% initiate or increase their use of unregulated opioids over here. And then 13% initiated or increase their use of cannabis. However, in both these cases, when you compare the percentage that increased or initiated use, it's far lower than the percentage that actually decreased or ceased their use of these substances. So from a net public health perspective, I think this suggests that psychedelics may be having a positive public health impact overall if it's reducing the use of more problematic substances like alcohol, cocaine, crack, or unregulated opioids. In terms of the change in other substance use, we asked individuals that cited a reduction, which psychedelic did you find particularly impactful in ceasing or decreasing the use of other substances? And psilocybin was the most often reported as being impactful in ceasing or decreasing the use of other substances. However, it's worth noting that despite ranking 8th in overall prevalence of use, ayahuasca ranked 3rd as the most impactful psychedelic for ceasing or decreasing use. So substances like ibogaine and ayahuasca that are not used frequently, but are often used to treat trauma and addiction, certainly shine in terms of the results of this kind of question. In terms of how psychedelics help individuals cease or decrease the use of other substances, our respondents said that the most common way was through increased connection with themselves, increased connections with nature, increased connection with spirit or with others, and also by changing their relationship with other substances. Now, ultimately, I'm an addictions researcher. That's kind of the base of the kind of work that I do. And if you look at the construct of addiction, it's gone through a lot of changes over the years. We used to consider it a moral failing, and then we considered it a biomedical kind of model where it was a disease of the brain. And now we're looking a lot more at addiction less as having less to do with the substances themselves than the kind of social construct and also the social determinants of health. And when you look at modern addiction research, you can see that disconnection from self and others is often a predictor of patterns of addiction, and that reconnection to others via different treatment modalities can be an indicator of success or successful treatment. And so when you gain an understanding that psychedelics can actually be useful in helping people feel more connected to themselves, others, spirit, and nature universally, you can understand why psychedelics seem to be effective at treating all kinds of addiction, whether it be addictions to alcohol, opioids, tobacco, or otherwise, because those are the factors, that reconnection to self and others, that can help with any type of addiction rather than a substance-specific addiction. We are very interested in peak experiences. So we asked individuals, have you ever had a peak experience with psychedelics? And about 86% respond having a peak awe experience with psychedelics. And the most common type of peak experience involved a mix of both positive and negative attributes. In other words, it wasn't all bliss, it wasn't all hell, it combined a little bit of both. However, over 43% report their peak experience was largely positive, and just over 7% report their peak experience consisted mostly of negative or challenging attributes. Uh, we also employed the awe experience scale developed by David Yaden et al., which is a 30 question, 6-factor scale with a maximum score of 7 in terms of the levels of awe that people experience from psychedelics and other awe informed experiences. And we were piloting the short form in this current study, which we reduced to 12 questions, but it remained a 6-factor scale within that. And when we look overall at the peak experiences reported by individuals, we see that they scored a 5.42 out of 7 from their peak psychedelic experience. Peak negative experiences, however, were a little bit lower in awe experience at 4.47, whereas the combination of both positive and negative attributes ranked the highest statistically at 5.48 out of 7. In terms of the set and setting that can result in positive or negative experiences, let's start by looking at the positive experiences. We see that out of a score of 0 to 100, with 100 being the best experience they've ever had in life, participants scored their peak positive experiences a median of 82 and a mean of 76. And the 3 most used psychedelics in peak positive experiences were psilocybin, LSD, and MDMA, accounting for about 63% of positive experiences. And despite uncommon use, DMT and 5-MeO-DMT accounted for 12.2%, and ayahuasca accounted for about 10% of intense positive experiences. And those of you who have had experiences with DMT, be it through ayahuasca or through vaporization or even injection of DMT will know that it is a profoundly deep experience, and I'm not that surprised to see it show up under these peak positive experiences or overrepresented here. Peak positive experiences typically took place with 1 or more companions, indoors, and in a familiar setting. Now, when we look at peak negative experiences, with 0 being the worst experience ever, participants scored this experience as a median of 39. And the most used psychedelics were once again psilocybin, LSD, and MDMA. And once again, those peak negative experiences typically took place with 1 or more companions, indoors, and in a familiar setting. Now, you'll find that those common psychedelics and those common experiences really reflect the fact that most people, because of laws and also understandings about set and setting, who are using psychedelics will typically use them with 1 or more companions using the same psychedelics in an indoor space in a familiar setting. So whether you're having a peak positive experience or a peak negative experience, it's likely happening within that setting. We did do some regression analysis that showed, for example, that taking psychedelics alone increased the potential or the odds of you having a negative experience. And once again, despite uncommon use, ayahuasca accounted for 8.2% of peak negative experiences. In terms of what makes up a challenging negative experience or a challenging psychedelic experience, over 50% experienced mental or sensory overload and or worried about their mental or physical health. But it's worth noting that other challenges included social paranoia, fear of never being the same at 43%, and troubling menacing visions at 40%, and worries about dying at 33%. The reason I think that it's really important to note this is although we all know that psychedelics are relatively safe, it's worth noting that people going or in the throes of a negative or challenging experience, that about 40% of them fear that they will never be the same, and about a third of them worry that they might die. In other words, not survive the experience. So for the individual in those negative experiences, these can be deeply disturbing. These are literally existential threats if you're worried about never being the same or about dying. So we never want to minimize the impact that a negative experience can have on individuals. And we always want to try and maximize the benefits and the odds of having a positive experience over a negative experience through adjustments in set and setting. In terms of negative experiences, we did want to probe that a little bit more. So we asked, did any good come from your challenging experience? And about 37% of respondents who had a negative experience reported that more good than bad came from their challenging peak experience. Nearly 25% experienced a balance of good and bad. But once again, notable that almost 40% experienced little or no good from their challenging psychedelic experience. In terms of those that reported at least a balance of good and bad from their most challenging experience, we asked what was it that was positive about that experience? And over half gained insight into very difficult problems or life issues. Nearly 40% overcame personal fears, and over 20% addressed traumas or experienced ego death. We're now going to move on to the therapeutic use of psychedelics. And about 60% of our respondents self-report using psychedelics for a health condition, about 48% for mental health, so about half, and about 21% for physical health purposes. In terms of mental health, the most common reasons for using psychedelics were depression, anxiety, and PTSD. Now, the great news is that's where most of the clinical research on psychedelics is taking place right now for mental health. So we have good studies and active treatments being developed right now, or psychedelic-based therapies to treat depression, anxiety, and PTSD. And I'm sure everyone attending this will be aware that MAPS, now known as Lykos, or MAPS PBC, known as Lykos, is expecting approval of MDMA as a treatment for PTSD before the end of this year, once again remedicalizing the use of MDMA as a therapy. Participants use psychedelics for mental health rank it overall as an 84 out of 100 in efficacy, so very efficacious. And about 78% discontinued their use of either talk therapy or pharmacotherapy in terms of their mental health treatments after initiating psychedelic use. So if you're a therapist right now and you're watching this presentation, please be sure and track this with your, or if you're an MD, by the way, please be sure and track potential changes in the mental health treatments that your patients might go through if they're going through psychedelic therapy. In terms of physical health, the most common reason to use psychedelics were chronic pain, headaches and migraines, or sleep disorders. And participants who use psychedelics for physical health rank at a median of 67 out of 100. So not quite as efficacious as the mental health component. But of course, the use of psychedelics for physical health is the kind of research on that is more in its infancy. It's not nearly as evolved as the research on mental health conditions and disorders. And so we will expect more data and maybe more clarity on how to most effectively use psychedelics for physical health in the coming years. In terms of healthcare practitioner interactions, just over 24% of respondents that use psychedelics therapeutically actually benefited from the guidance of a healthcare professional. So overwhelmingly, most of those who use and identified using psychedelics for therapeutic purposes did not benefit from the guidance of a healthcare professional, but 85% said they would use with the support of a healthcare professional if that was a legal option. And of those that did receive psychedelic treatments from a healthcare practitioner, nearly 50% suggest it was very important to the success of the experience, and over 90% assign at least some importance to healthcare oversight and support. Now, I don't need to tell you all that legal access to psychedelic treatments is what's largely impacting this, and regulations that are blocking legal access. However, we're slowly seeing those change. There are now psychedelic clinics like Savvy Mind and ketamine clinics all over Canada, the US, and Europe that are opening up and providing opportunities for legal, physician-guided or physician-supported psychedelic journeys. And of course, through a growing amount of clinical trials, patients are also some patients, a very small, limited amount of patients, are able to access psychedelic treatments through clinical trials. In Canada, we also have a special access program that's providing legal access to a tiny handful, just over 100 patients a year right now, but it is progress compared to a few years ago. And in Australia, they've now passed regulations, although they seem to be quite prohibitive and challenging, that'll enable some psychiatrists to prescribe MDMA or psilocybin in the treatment of specific conditions. So long story short, there is increased legal access to psychedelics happening around the world, but it's not happening at nearly a fast enough rate to address the growing mental health crisis, the growing chronic pain crisis that's impacting healthcare delivery all around the world. To close off this presentation, I wanted to touch on some of the qualitative outcomes of our study. After filling out this incredibly long survey, we asked all participants, is there anything else you'd like to share with us about your use of psychedelics? And to our surprise, about 25% of respondents had more to share or more to say about their experiences with psychedelics. So we did an NRC lexicon analysis, which you see here on your left. And this suggested positive outcomes and emotions were more common than negative emotions, although you do see a balance of positive and negative emotions here, in that you see fear, sadness, anger, and disgust were also part of this very primitive and very preliminary textual analysis. And when you look at the Bing lexicon analysis, which is displayed as a word cloud to the right, you can see this balance as well. The positive attributes like, better, positive, help, work are interesting, but I also want to point out that even the so-called negative attributes, depression, anxiety, trauma, difficult, may be reflective of positive outcomes with psychedelics if people were using them to treat anxiety, depression, trauma, etc. So we're very grateful to our friends at UVic who are currently doing a much more detailed qualitative analysis of some of this textual data, which will give us a better sense of the actual experience of end users. And in so much as quantitative survey data can be really useful in explaining the psychedelic experiences, these are very complex, and I find that that text and qualitative data can really add the heart to the head of what it is that a psychedelic experience is. To close out, I'd like to share a few quotes from our qualitative outcomes. In terms of negative quotes or negative outcomes, one participant said, psychedelics are difficult to come by. Ketamine cost me about $1,000 for 6 sessions. I'm now on a fixed income, and I'm not sure I can afford any psychedelic. I tried microdosing. It didn't work great after 1 month. I had an extremely bad experience with ecstasy and alcohol and decided not to take it anymore. I would take mushrooms again, but right now, being very stressed for work, I'm scared of anything that can alter my mental state. And lastly, unfortunately, I had 2 bad trips with LSD when I was very young that followed me into my mid-20s despite getting help. It's easier now, but I've had to deal with a lot of trauma, psychotic episodes due to them. Now, looking at more positive outcomes or positive experiences, we hear that using micro and active doses of psychedelics helped me to engage more with society and removed a lot of my fears. Use of psychedelics, particularly ayahuasca, has changed my entire life for the better. I'm kinder, more present, and less angry. I'm content with my life. And finally, using psilocybin was the most extraordinary experience of my life. My depression and anxiety was greatly reduced for several weeks after using. I would use it again in a heartbeat, but I currently do not have access. So in terms of next steps with this data, we're currently, Stephanie and I are working with our collaborators on about 10 to 12 GPS publications. We have 3 that are already in press or published. We plan to share these findings with policymakers, with patients and physicians, and with health insurers, as well as with the general public, in order to inform public policies that might be forthcoming and increase the opportunities for cost coverage from private payers, therefore removing one of the primary obstacles to psychedelic therapy access, which is costs. And we're looking right now to identify academic collaborators to translate GPS into additional languages for the 2025 edition of this survey. We are in discussion with academics who want to do a translation into Portuguese or Polish or Russian versions. And we're also looking for collaborators to do a Spanish translation. So if you're an academic at a research site that might be able to contribute to 2025, via translation and therefore dispersal beyond just an English-speaking population, so that we can get a more diverse group of respondents. We'd really love to hear from you. Please get in touch with us. Finally, my sincere gratitude to my co-PI, Stephanie Lake at UCLA, all of our academic collaborators who are just amazing to work with. You can't do a large survey like this and a broad study like this without significant collaboration, and you certainly can't do it for under $30,000 without the help of researchers like this and the nonprofit and NGO groups that help us distribute the survey. I want to thank our study participants for sharing their experiences via this very, very, very long survey. Our sponsors, MAPS, SavvyMind, Mind Medicine Australia, and Tiny. And finally, all of you for your time, interest, and attention. I'm very grateful you spent this lovely Friday afternoon with us, and look forward to your questions.
Great. Thanks so much, Dr. Lucas. I enjoyed your beautiful slides and walking us through the survey. So we're going to have some questions coming in. If anybody wants to drop more into the QA section, I'm going to go ahead and launch my first one, which is, it looks like you only took responses for 2 weeks on the survey. And how did you get so many participants in that short amount of time?
Yeah, I love big, complex collaborative projects. I really love them. And we used what I call a shotgun approach. So we spent months planning the launch of this survey and deciding what the time period was that we were going to collect on. And we reached out to NGOs like MAPS here in Canada, MAPS Canada, the Psychedelic Association of Canada, in Europe, Open Foundation, and ICEERS in Australia, Mind Medicine Australia, and other groups as well. And we had the benefit of a lot of our academic collaborators tweeting out links to the study as well. And on the first day of our launch, we blanketed as much as we could the inboxes of psychedelic users and social media psychedelic sites with opportunities to join this survey. And then we did a reminder the following week, and then one last reminder on the second week. I've had a lot of experience now of doing these very broad population-based surveys with cannabis and psychedelic users. And my experience is that you get about 75% of respondents in the first 3 days, and that you can get a tiny little bump in further respondents by sending out reminders at, say, 1 week in and say 2 weeks in. But beyond that, you're just going to get a small trickle of folks beyond the 2 week mark. So I don't see a lot of use in doing a big, long survey date if you are willing to coordinate a kind of a shotgun approach in terms of the launch. I love the results of this survey. We're going to get 10 or 12 publications out of this data. So this is significant. But to me, one of the most remarkable things about this kind of study is, as I mentioned, we did this for about a $25,000 budget. So to the best of our knowledge, it's one of the largest surveys of international English-speaking psychedelic users ever conducted. And we did it for a drop in the bucket in terms of the cost of normal research. We need to find ways to do research more quickly, more effectively, and that's more reflective of end user experiences. And I think that this demonstrates one way to do that, and the value of observational research in providing quick, useful, high quality data that can then inform clinical trials and other studies that might be going on as well. So I really value and am grateful ultimately to the end users and our collaborators, in other words, psychedelic consumers and our collaborators for helping us achieve the goals of this survey.
That's great. Yeah, the response is phenomenal for participants on a survey. And just to follow up with some questions about, it can sort of be an echo chamber with the organizations that are involved in psychedelics, the mailing list, the people that subscribe to those. So Dominique, who's in our audience today, has asked questions about, how can you make this research more inclusive, maybe reach populations of people that are from diverse backgrounds. If you could speak to that a little bit.
Yeah, absolutely. One of the primary limitations of this survey, obviously, was that it was an English language only survey. There were many reasons for that, just wanting to get this survey out in a timely manner, to test the waters of what this kind of global survey and our reach of this kind of global survey would be. And I was pleased, as I mentioned, to get responses from 85 different countries, although as you've noted, obviously in the presentation, most of those were Anglophone. Most of our respondents came from Anglophone countries. So we know we're missing a huge swath of the population here. First and foremost, South and Central America, where the use of a lot of these classical psychedelics was developed and continues to be used for traditional and spiritual reasons. And that's the primary reason that we're trying to get Portuguese and Spanish versions of these surveys up and running for the 2025 iteration of this. And we're really optimistic that we're going to be able to gather a much greater plurality of respondents, but that's clearly one of the limitations. I do want to share that one of the real privileges of being a cannabis and psychedelic researcher is that the end users of cannabis and psychedelic, the consumers of cannabis and psychedelics, I think feel largely dispossessed sometimes from the traditional healthcare setting. And that makes them in many ways eager to share their thoughts and their outcomes and approaching psychedelic consumers in a respectful manner that allows them in a community-based research manner to share their thoughts, their expertise, and their experiences, I think is a great way for us to learn a lot more about psychedelics and their safe use as well as maybe problematic patterns of use. So it's a real privilege as an academic and also as a member of the psychedelic consumer and cannabis consumer crowd myself to be able to open up opportunities for psychedelic users to share their experiences and then to reflect those experiences in data that we publish to inform policies that can ease some of the obstacles to access.
Yes, it seems like people maybe were able to answer very honestly, as I feel like maybe, 5 or 10 years ago, there was sort of this push to bring psychedelics into the light and from the underground, and maybe a more bias to having people reflect their positive experiences. So seeing this balance of negative and people wanting to share that piece, which is more reflective, I think is what's actually occurring out in the population.
Yeah, although I think it's fair to say, Ali, that we probably had, and this is going to be in all of our publications, an overrepresentation of people with positive outcomes and an underrepresentation of negative outcomes, and that our outreach was done through social media channels and groups that kind of cater to the psychedelic community, and those that have had negative outcomes may have ceased their contact with those groups or organizations. That's just one of the limitations of this kind of population level survey. I don't know that there's a real way to avoid that, but we are pleased that we did gather such a large number of people who were willing to share their negative outcomes as well, because I think as a psychedelic community, we need to acknowledge that those are possible outcomes of psychedelic use and do our best to mitigate the chances of those happening as well.
Right. I wonder too if you send it out to the mailing list of Fireside Project, which is specifically focused on providing the service, a free service. If you're having a difficult experience, you can call this number, you can chat with someone, or you can call for integration after. So it's a great resource for those in the audience that haven't heard of it. But
I love the Fireside Project, but it didn't occur to me to include them in our dissemination list because I thought all their services were anonymous, so they might be able to help promote it on their website, but I don't know if they maintain an email list. However, I've added that to our list of potential partners for dissemination in 2025, and I'm open to suggestions. If you're in the audience today and you didn't have a chance to fill this out, please share with us what, and I'm easy to reach, by the way, at plucasyj@gmail.com or at philippe@savvymind.com. Please share with us some of the organizations you think we should contact to let them know about the next version of this survey to make sure that we can capture your voice and experience as well.
Yep. So, and along that thread, we have a question about, are any plans to do a translation for Chinese, Hindi, and Arabic? It's so easy now with some of the translation services.
Yeah, the challenge is that two things need to happen to translate a survey like this. You need to have a good, accurate translation, and then it needs to be approved by ethics as well. So they need to literally review each of the different translations of this. So it does add some cost. So right now, we'd much rather work with academics who are already interested in psychedelic research, but doing so and doing their research in other languages. So academics, for example, in Brazil, who might be working in Portuguese in their psychedelic research, et cetera, to see if they can come on board, help us translate this into Portuguese, but also then be the primary folks to analyze the Portuguese language respondents as well as the broader plurality of respondents, so we can compare respondents from one geographic area to another as well. So I agree there are good translation services out there, but AI is faulty, and this is not the kind of study where you want to have any vagaries in the language that might impact the overall outcomes of the study. We want to work with other academics on this on that front.
Great. So I hear a call for other academics in countries of different languages that can be collaborators for this.
Absolutely, absolutely. If you have a bit of resources to contribute to, as well to the ethics review costs, which are about $3,000, and then I think $1,000 for per language, that's great. Or if we can use your academic institution to do that specific language ethic review, that's useful as well.
Awesome. So we have a question here about participant didn't hear anything about integration of psychedelic experiences in the survey.
Yeah, I didn't touch on it in this presentation. We did ask about integration and practices. We also asked about other wellness practices that we're taking care of. I should mention in this 600 question survey, like what I just shared today was very high level data. And we get very granular on a lot of our questions. For example, our friends at McGill, Professor Alex Lehman and Kyle Greenway have a lot of interest in psychedelics and music, and as well as persistent hallucinations associated with psychedelic use, and the impact of media on psychedelic experiences and the hallucinations associated with psychedelic experiences. And they're writing up all of that data. I didn't present on that data today because, of course, I have to be selective as to what I'm presenting on, and so you're likely going to see some publications that look at healthcare interactions with from psychedelic users. Did you talk to your primary physicians, your healthcare practitioner about your psychedelic use? If not, why not? Testing services are going to be in one of our publication. Are you getting your psychedelics tested for purity and quality? And if not, why not? As well as some of the questions that have been asked about integration and other set and setting aspects as well.
Yeah, so something that stood out to me was when you're talking about the negative peak experiences, that the majority were indoors with other companions. Is that at home settings, at a retreat setting? Did you have any more information about that? Because that's kind of surprising. I would have thought maybe a festival or something like that would be the most frequent place.
Yeah, I think that I mean, obviously there's value in all of those, but I'm not really surprised that the most common use and or that, when we're talking about peak experiences, that it would be in an indoor setting rather than and within a familiar setting rather than a festival. I think obviously there's a lot of psychedelic use at music festivals, and a lot of festivals do a great job of creating a very safe setting, everything from drug testing services to basically creating an adult playground. Ali, you and I have had the pleasure of attending some fun events in the past together, and I think that those festival settings are really important. But when you look over the long-term use of psychedelics in people's lifetime, I'm not surprised that most of the use, be it for macro or micro use, is at home or in a familiar setting. I think that that's where people feel they can control the risk of negative outcomes the best. And I think that even use in a festival is kind of more advanced use in that you have to be willing and able and understand how to engage with other individuals and strangers in a public setting. And for a lot of people, I think that creates a perception of a higher risk, or at least the risk of embarrassment, if not an actual physical or other risk. So I think that the finding that most people who are using psychedelics are doing so with friends or family in a familiar setting is fairly, that kind of is par for the course. I think if we were to look at warmer climates, you'd see more use outdoors. But I'm not surprised that, in, let's say, Northern Europe and in Canada and the US, a lot of the use is indoors.
Yeah. Yep. So the next question here from Kim, there are two questions here, but I think I'll ask the second one about, was there any information about whether or not the microdose practice was more effective for mental health outcomes compared to full dose?
Oh, that's interesting. I don't think we've conducted that full analysis, but I'm pretty familiar with the data, and I would think that the microdose data, when we ask respondents why do you microdose, it's mostly for wellness practices. And so I want to differentiate between wellness, like feeling better or feeling more creative, having a more productive or positive outcome on life, and actual therapeutic use, like for PTSD, trauma, substance use disorder, depression, or anxiety. So I think that when it comes to the efficacy, we probably see greater efficacy coming out of the maximum dose or higher dose treatments, but we probably see more people using microdose because of legal access and otherwise to microdosing. My wife is a therapist, and she says that almost all the patients she has right now that are under the age of 40 are microdosing, or at least have some experience with microdosing. It kind of reminds me of where CBD was about 15 years ago, where it seemed like everyone was using CBD, taking CBD in the morning or with their coffee or otherwise. And there wasn't a lot of evidence of benefits, but probably no risk of harm. I think that, I tend to give a lot of primacy to end user experiences. So I think there probably are some benefits from microdosing. But I am really resistant to anyone who says that microdosing does this or does that, because what our data makes clear is that patterns of microdosing differ significantly from one individual to the next. So some people are microdosing psilocybin 3 days on, 3 days off, or doing the Stamets stack along with niacin and otherwise. Some people microdose every day for 3 months and then go 3 months off. Some people are microdosing salvia divinorum or microdosing DMT. And if you're amongst those folks, please give me a call or send me an email. I'm really interested in finding out what benefits you're getting from microdosing salvia or DMT or some of these more, I don't want to say marginalized uses, but less common uses as well. So I think overall, the science on microdosing is still young. We're going to get some good results from clinical trials in the next couple of years, even within the next 12 months, that I think are going to elucidate some of the positive potential therapeutic aspects of microdosing. But I think it's too early to tell right now, except to say that most people who are microdosing in our study have found beneficial effects.
So that to me, I think really speaks from these surveys and the point of doing them, of like, you can do rigorous controlled trials and there's limitations there. And like just wider samples of people, I think really gets at real world outcomes. And if people experience benefit, whatever that is derived from, some like to say it could be a placebo response possibly, but if there's consistent replicable responses, I see that as really valuable information, and individuals knowing how to kind of track their own data, their own mental health outcomes. And also knowing, when to quit, because I also hear of negative side
Hmm.
effects from microdosing, like anxiety, inability to sleep, and or feeling dependent on, like, I need that microdose to kind of have that mood boost. That's something to also be aware of.
Listen, I think you're exactly right, Ali. And I want to share a term that I really like as a social researcher, which is community-defined evidence. I want to differentiate between anecdotal evidence, which is what happens when my mom says her friend's daughter's sister cured her cancer by smoking cannabis, or cured her depression by microdosing psilocybin. That's an anecdote. That's one individual. I don't dismiss that that's possible, but that's an N of one. Community defined evidence is when 1,000 people share that they're gaining benefit from microdosing. And I think as academics or folks involved in public health, we need to take notice when you have a large plurality of folks that say that something is either helpful or harmful. And we need to give that some credence and try and dig a little deeper into the data to figure out why that might be.
Yep, great. Well, we're here at the top of the hour, and we actually didn't get to all the questions, so I'm sorry about that to our participants, but we'll have to have you back on, or one of your colleagues, to give the rest of the data summaries from the survey.
Absolutely. Thank you so much once again to everyone who stuck around for this presentation. Definitely to Psychedelic Support. You guys are such a great resource, and all of the Savvy Mind clinical staff is trained on ketamine administration on Psychedelic Support, along with other training they do. So we're very grateful to the great service you guys provide. And Ali, it's just always a pleasure to work with you. And to everyone who's still on the line, don't hesitate to reach out if you have any questions. I'm happy to share, and I think Ali has shared a link to the first publication from the Global Psychedelic Survey that's focused on reductions and changes in the use of other substances. And please feel free to email me if you have any further questions, suggestions, or concerns about any of the research that we're doing. Thank you so much.
Yeah, excellent. And we'll send out a follow-up email with the link to this video and the resources shared. And again, thanks for being here. We appreciate your participation, and have a lovely weekend.
You too. Everyone
Thanks
enjoy
so
the
much,
sun if you
Philippe.
got a little sunshine on you, and have a great weekend.
Yeah, cheers. Bye.